So now the lockdowns to limit the spread of COVID-19 in most African countries have had a devastating socio-economic impact on migrants. The International Organization for Migration, the IOM, says that there are more than 36,000 Southern African migrants that are stranded in their countries of destination. These include over 5,000 South African migrants that are stranded in different countries around the world. The IOM says that there are currently about 300 South Africans stranded in India, 307 in Thailand, and about 140 of them in Bali in Indonesia. Well, to discuss this, I'm now joined on the line by the IOM's Regional Director for Southern Africa, Charles Kwenin. Charles, thanks so much indeed for joining us and welcome to the program.
Thank you very much, Peter. Good evening.
So it's often, when we're focusing on these diseases, we're often very inward looking and we don't realize that migration is affected and is happening in many ways. And I just wonder if you could start by just giving us a sense of the migration trends and dynamics in the Southern African region at this time. Perhaps you can share with us maybe some figures just to give us a sense of what's happening on the ground.
Yeah, thank you very much, Peter. As we all know, we are living in a world of unprecedented human mobility at a time when we have many more people moving than ever before, with 1 in 7 persons being a migrant. And with this coronavirus pandemic, it has resulted in one of the most unprecedented restrictions on human mobility through lockdowns, through closures of borders, and suspension of airlines, which has led to affected many economies, developed or less developed, at the individual level, rich or poor. So when we take the Southern Africa region, the SADC region, which hosts one of the highest numbers of migrants. For instance, when we look at the migrant stock in 2019, we had about 7.9 million migrants within the SADC region, which constitutes about 2.3% of the total population in the SADC region. And of this 7.9 million, we had about 4.2 million in South Africa alone, which is about 7.3% of the South Africa population, and 53%, and South Africa hosting about 53% of the total number of migrant stock within the SADC region. So if we imagine that the virus at this point in time as we talk is close to 35,000 in South Africa alone, we can imagine the impact on migrants who have lost their livelihoods, who have lost their jobs and income. And more importantly, the diaspora are losing a lot of the remittances, which they would normally be remitting back home to their parents and their relatives whom they have left behind. So indeed, the virus is affecting significantly the migration dynamics, the patterns and trends in Africa, globally, and in the Southern Africa region in particular, given that it hosts a number of middle and upper middle income countries.
All right, so these migrants that are stuck in various countries of destination and are not working, they have very little to fall back on in terms of support. Describe some of the challenges that they're facing just to survive.
Well, it's been a very tough times for migrants in particular, given that a number of them are not working, they have lost their livelihoods. Most of them, especially in the Southern Africa region, the SADC region, we had about 65,000 returning back to the region, whilst we have about more than 35,000 who are stranded, either in transit or within countries of destination. And a number of them have been left out in the social safety net, in the stimulus packages by various governments. So these have left most of them in a very difficult situation, of which many of them have now decided to go back. In a number of the countries, even though it may not be a government policy to leave them out, especially when we take the health services, basic social services, but sometimes the attitude of the local population, the local communities, to the migrants makes it a bit difficult for migrants to access some of these facilities. And that is why we think it's very important to address issues of stigmatization, issues of, xenophobia, violent attacks that we've seen globally in a number of locations where migrants are stigmatized as if they are carrying the virus. So it's not only being left behind or left out of access to basic social services, but the stigmatization in itself has a significant toll on them, besides the loss of income and livelihoods as well as jobs.
I would imagine also that even those that do manage to find a way to get back home to their countries of origins, a whole new set of problems are waiting for them there, because many of them have been away for many years, and it's not just a question of being able to just come back in and start as they were before they left.
Indeed, that is one of the very difficult challenges or significant challenges that we are facing now, because a number of them left their relatives, their spouses, their families back home, to look for greener pastures, to look for opportunities. Now they have to go back home empty-handed. A number of them have to borrow monies to come. Now going back home without anything is a very serious challenge. Now the coronavirus, the public safety net that we have had to put in place also indicates or suggests that once they get back, they have to be quarantined for a couple of days, about 2 weeks, before they see their parents. And going back without anything, with empty hands, that is seen as a failure or disappointment and frustration. So the psychological impact, the mental health, and the frustration and disappointment, the anxiety in itself has a lot of mental toll on them. Besides the social and economic impact, the psychological impact cannot be underestimated as well.
So what kind of responses, actions maybe can governments and authorities on the continent and in our region take to mitigate some of the effects that are affecting the migrants in the region?
Well, I think governments are already doing a lot. In the very short term, many governments instituted lockdowns. The South Africa region, South Africa, some of them instituted one of the strictest, measures to contain the virus. But within the Africa region, I think there are a number of things that governments can do. I mentioned the issue of inclusion of the vulnerable population, migrants, refugees, and asylum seekers being included in the social safety net and social protection and stimulus packages. I think it's also very important for African governments to invest in scientific research and development, and also to invest in local production capacity, because for the PPEs or the protection, the personal protection equipment, these are things that we should be able to produce in country instead of having to import them in times of crisis. It's also important that our government invest in our healthcare systems. But more importantly, Peter, I think it will be very important for our government to take seriously the issue of ratifying the protocol of free movement of persons. Our governments have ratified the continental free trade in Africa. But then the issue of free movement of goods and services move with the people, for the people. So I think once our governments have ratified the continental free trade, it will be important for them to consider the ratification of free movement of persons as well. And here, I think it will be important to underline that when we talk of free movement of persons, it does not necessarily mean violation of sovereign borders. We are talking about facilitating the mobility of persons across international borders to facilitate or to remove the barriers to trade. So even issues of removal of visas or visas upon arrival all constitute facilitation of mobility. So it's not a matter of violating the sovereign borders. And in Africa, we have the least inter-regional or intra-Africa trade. In Europe, we have about 60% intra-Europe trade. In Asia, it's about 30%. For us in Africa, it's about 15 or 16%, which is very low. So it's high time our government take seriously the issue of intra-Africa trade by removing the barriers to trade, of which it includes the ratification of free movement of persons, because in Africa, about 70% of women constitute the cross-border trade, which is very significant in the informal sector, even though more often than not, it's not quantified in the statistics. But it creates a lot of jobs, it creates a lot of increases the GDP. So we have to take some of these issues seriously. And to conclude on that, we are working with a lot of the embassies. And thanks to the European Union, thanks to the governments of Japan, the US government, Irish, the Dutch, Swiss, and Sweden, we've been working with the embassies to assist the migrants who are willing to return home. So far, we've assisted over 400 of them to go back home. A number of them have returned on their own. Come next Friday, we are moving around another 200 to Zimbabwe. So there is a lot that governments are doing, but then there is a lot more that could be done. And we are working with the UN agencies, our partners, WHO, who we all know are assisting with this pandemic, WFP with the assets, the hubs in Accra, in Addis, and now Johannesburg. So we hope that that will also facilitate the mobility within the region for the free movement of goods and services, as well as free movement of persons. And at the regional level, the UN regional organizations and the regional directors are working with government, with civil society, with the UN country team, to support the efforts of government in addressing the pandemic, whilst at the same time, taking care of the vulnerable groups, including the migrants whom we serve.
Mr. Kwenin, you spoke about, encouraging and the ratification of the movement of people alongside the movement of trade. And I just wonder, we've got our borders closed at the moment, and COVID-19, they talk about a whole new world that we're going to be a part of, waking up to and going into even after COVID-19. You don't think that these borders are going to be a harder thing to open once COVID-19 is done? Because one gets a sense that once you've closed these borders and you start to be more protectionist, the movement of people becomes that much more difficult.
That is correct, Peter. In the very short term, it's very important that our governments have taken the necessary and appropriate measures to close the borders to contain the virus. But this will have a medium and long-term effect on trade, because most of it's affecting intra-regional and inter-regional trade, global trade, as well as within the region, the SABC region and Africa in particular. But for how long can we continue to close the borders? And this will change the migration trends, the patterns and dynamics post-COVID, because we are likely to see more irregular migration, because people will be looking for more opportunities. But what we need to do is to enhance the border management systems at the borders. We're going to see many more human traffickers and smugglers, smuggling people across, different borders, and people using irregular pathways to enter countries. It's likely that migrants will change their destinations, looking for different opportunities, becoming more innovative. So we have to enhance the capacities of our border officials. We have to enhance the capacities, the border management system, the infrastructure. Because as I said, for the free movement of persons, it's not easy that we talk about free movement of goods and services without talking about free movement of persons, because the goods and services move with the people for the people. And that is why it is important that once we talk about free movement of goods and services, it's important to harmonize the immigration policies, the migration policies. And I'm glad that over the weekend, the SABC ministers had this virtual discussion talking about the harmonization of policies. So indeed, it's not an easy issue, but then we have to address it because the virus knows no borders. So, and in the same vein, we have the security aspects of migration needs to be addressed. But addressing security aspects of migration does not mean closing the borders. When you control borders, you close borders, migrants are going to find alternative and irregular routes to enter anyway. They will go through the back door. And that is why we recommend that whilst it's important to manage the borders, the most important thing to address the security aspects is to institute more and enhance the border management systems to be able to facilitate the mobility, whilst at the same time being able to detect the unscrupulous people who are in to cause trouble, and at the same time being able to address the public health aspect of migration, because at the end of the day, the COVID has demonstrated amply that migration also has a public health implication which needs to be addressed together.
All right, Mr. Kwenin, we're going to have to leave it there, but I suspect we're going to need a few more conversations about these issues in the coming days. Thanks so much indeed for joining us this evening.
Thank you very much, Peter. It's a great pleasure.
All right, that was the International Organization for Migration's Regional Director for Southern Africa, Charles Kwenin, speaking to us.